Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by 90-Day Jumpstart, a program to help you increase production and break free from financial stress. Dental Fuel is excited to welcome Dr. Gabriela Flores, a practicing dentist based in Miami Beach, Florida. Dr. Flores graduated from Tufts University School of Dental Medicine. After graduation, she went into a DSO where she garnered a wealth of experience. After working at a DSO, she took a leap of faith into the world of practice ownership, where she acquired her own practice in Miami Beach. In this episode, Dr. Flores talks about a clinical mistake that she has made, as well as career advancements, unexpected challenges, and valuable lessons that she has learned along the way. Let's tune in. All right, Gabriela Flores, welcome to Dental Fuel. How are you doing today?
I'm doing well. Thank you so much for having me.
I'm so excited to have you here at Dental Fuel and have our listeners learn a little bit about yourself, and for myself to learn a little bit about you as well, too. And I'm really excited because a lot of our guests are people that I know, but you are actually somebody that I don't know, and I'm excited to learn more about you. But Gabriela, please tell me and our listeners a little bit about yourself.
So, my name is Gabriela Flores. I am a dentist practicing in Miami Beach, Florida. I went to University of Florida for undergrad. I went to Tufts University School of Dental Medicine for dental school. And I worked in a couple of places after I graduated. I worked in DSOs, I worked in PPO practices, I even worked in a holistic practice until I bought my own practice 1 year later here in Miami Beach, Florida.
Very cool. Gabriela, how many years have you been out of dental school?
So now 3.
Okay, cool. So you're a new practice owner a few years out of school. Did you do any AGD or GPR programs?
No, I did not.
Very cool. And did you always know that you were going to be a practice owner?
Yes.
Cool. And the first 3 years out, how have you felt learning just all about dentistry and that transition from working in different offices to starting your own practice?
Well, I graduated in the middle of the pandemic, so it's
Fun.
definitely a unique situation. I kind of didn't really have a choice. My situation was particularly unique because of our location situation, but that's just a very long story. Basically, we moved to where I got a job.
Okay.
So, yeah. And it's been fun. It's been crazy. I've definitely seen a little bit of everything, but I've learned a lot along the ride. I definitely had a non-traditional route, I would say.
Tell me a little bit about that non-traditional route. Why would you consider that to be non-traditional?
I think mostly because I bought a practice that didn't belong to someone I know or like a family or friend. So I did it all myself. I have no family in the dental field. I have no connections. I did it all on my own merit. So I think that that would be non-traditional in the sense where I bought a practice 1 year out of dental school pretty much with without it being a legacy practice.
Well said. And how, going into a practice where, you didn't know the owner, how would you feel the patients were as far as being receptive to you coming into this practice?
So as far as patients accepting me, I really didn't have a hard time at all because I did so much work in so many practices that I had to be the new doctor coming in. So I had practiced so much on winning people over that by the time I bought my practice, I kind of had it down. And I would say I always come from a very genuine place. And since it's my practice, we actually had a really low attrition rate in my practice. I'm very proud of it because it is a fee-for-service practice. So that makes it even more difficult when you're buying the practice that belonged to someone who was a fee-for-service owner. They're paying to see that person. But I actually had a really easy time. Most of the people we lost were because of distance. We had, a lot of people moved to Miami and a lot of people moved out of Miami. So I would say that's where most of our attrition was. But the rest was I've met some wonderful people along the way.
Well, that's wonderful. Congratulations to you. That's excellent.
Thank you.
Well, here at Dental Fuel, we are dedicated to sharing each other's mistakes and learning and growing from the mistakes. So I'm going to ask you a few questions, and I would love if you would share a little bit about some mistakes and how they've helped you grow.
Cool.
Our,
Um,
fir-
Oh,
Yeah,
sorry.
so no, I'll jump into the first one, but I would love to know a little bit about a clinical mistake that you've made in your short 3 years out of dental school and how that mistake helped you grow as a clinician.
It's so funny because you say it's short, but it's felt so
I know.
long because of this particular way that I've been working and after, the pandemic and everything. But um, in the short 3 years I've been working, I would say an important lesson I learned is that mistakes are normal. So I can give you an example of my mistakes. I think that I handle my mistakes really well, and I think I can hopefully inspire some people with how I handle them because no one person has the answer. So I always come from a very honest place, and I always come from doing my best work possible. So that way, if I do make a mistake, it's very easy to overcome it because I know that I'm doing my best. I'm never cutting corners. It's much easier to do when you're a practice owner and you don't have someone dictating your treatment. I understand that. So I have a recent one where I went in to try to restore the tooth. I thought it was restorable, but it was non-restorable. So I actually prevent before I even make a mistake. I already start with I go by the under promise over deliver. So when I have something that's even borderline questionable, I always kind of prepare the patient. Even if it's a 1 millimeter deep cavity, I kind of tell them, they ask, is there going to be sensitivity? I say, there's always going to be
Yeah, always a chance. Always a
sensitivity.
chance.
There's
Yeah.
always a chance. So I already prevent a little bit there. I never overpromise, underdeliver, or at least I try not to. So one recent one is I thought it was restorable, and once I went in, it wasn't. That decay was just really deep under the bone. Wasn't the best situation as far as perio, so I would say it was questionable to hopeless. So even sending him for a crown lengthening would have been iffy, right? And then you have to consider patients' finances. Are they willing to invest in a crown lengthening for a questionable to hopeless prognosis?
Right, right.
So I sat him up. So I never tell them while they're laying back with their mouth open. I say, let's take a break. Would you like some water? Okay. But I stay calm during this because it happens, right? It happens.
For sure. Yeah.
So we're basically doing surgery awake. So if a surgeon did something, they have time to step away, come back, breathe. We don't have that luxury always. So I sat him and I said, remember how we spoke about the fact that there was big decay on this and that I wasn't sure exactly how it was going to be when I went in? Well, it turned out that it wasn't restorable. Then I gave him the options and then we moved forward. But it was my mistake in the sense where I did feel a little bit more optimistic. I try not to go into a tooth if I know it's not restorable. I would say that that's how I approach my mistakes is I sit the patient up and I tell them, hey, this happens, it's normal, but we're going to take good care of you. If we need the specialist, we're going to work with the best specialist. And on my end, I'm going to work with you. And since I do own my practice, so I don't charge them for that visit. I charge for the following work in the sense where they'll just pay the deposit towards whatever it needs. So let's say it needed to be extracted. They pay towards the implant crown. Even though it's 6 months down the line, they'll just pay a deposit towards that. And then at least I got something that visit, but then they don't feel like they paid for something they didn't receive.
Oh, I like that. Yeah, I think you have some really great pearls in here. First and foremost, setting patient expectations and letting them know that stuff does happen and dentistry can be tough. Things can seem predictable going one way, and it can definitely turn out to be something completely different. It's practice of dentistry. We continue to practice and learn every day. But the other to be truthful and do right by the patient. And I think that if you always put the patient's interests first, everything will follow suit. And I bet you that your patients have been very grateful for your truthfulness and have probably stuck around because of that.
I'd like to think so. I hope so. I've been told that, so I could confirm. And yeah, I completely agree. I think the biggest thing about the mistakes is getting ahead of them because they will happen. But if you have your setup, if you're in the right place before, it'll be very easy to deal with.
Thanks for tuning in to this episode of Dental Fuel. Join us next week as we are back with Dr. Flores discussing a financial mistake that she has made. Be sure to check out 90-Day Jumpstart, dedicating to helping you reach your practice goals quicker. You can find out more at ignitedds.com. Be sure to follow us on Instagram @DentalFuel and @IgniteDDS.